For many patients and healthcare providers, religion is an essential part of their lives. For these individuals, religious beliefs and values shape how they think about health and disease, influence the things they do to stay healthy and combat illness, and inform their ethical values when faced with critical healthcare decisions. When healthcare systems do not know how a patient's religious identity impacts their healthcare decisions, they cannot provide culturally appropriate healthcare resources. To illustrate how religion may impact a patient's healthcare decisions, consider an encounter between a Muslim patient, Hakima, and her physician, Dr. Jones. Hakima's aunt was just admitted to the hospital with advanced breast cancer and is doing poorly. Shaken by her aunt's experience and concerned about her own risks, Hakima visits Dr. Jones to talk about cancer screening. She also wants to know how she might avoid unnecessary procedures at the end of life. Although Hakima wears a headscarf, because the patient information sheet does not ask about religious affiliation, Dr. Jones is uncertain about Hakima's religious identity. Furthermore, she hesitates to ask Hakima about her religion because of the current socio-political climate. During the visit, Dr. Jones tells Hakima that mammograms are used to detect breast cancer, discusses blood tests that can screen for cancer-related genetic mutations, and informs her about living wills. At the end of the visit, Dr. Jones gives Hakima generic brochures about mammography and blank living will templates. As she leaves the doctor's office, Hakima is startled to find that the mammography brochures have pictures of disrobed women standing in front of an X-ray machine, and decides that maintaining modesty is more important than getting a mammogram. As she reflects on the conversation about genetics influencing disease, Hakima feels that since God controls whether one gets cancer, genetic tests will only cause her more anxiety. She next goes to consult her religious leader, Imam Abdullah, about the living will form. The Imam tells her that living wills are not Islamic. Consequently, Hakima decides not to fill out the forms given to her by Dr. Jones. In the end, Hakima's original concerns remain unresolved, and she feels conflicted about her decisions. Hakima's story exemplifies how a patient's religious identity can impact a variety of healthcare experiences and decisions, and highlights how physicians and religious leaders may not be equipped to help patients fully consider their options. Dr. Jones might have been able to allay Hakima's concerns about maintaining modesty if religious values had been discussed during the visit. Imam Abdullah could have discussed the Islamic responsibility to care for one's body and rulings about end-of-life care had he understood the clinical context behind Hakima's questions. The scant research on Muslim health and the few primers on Islamic bioethics leaves people like Hakima, Dr. Jones, and Imam Abdullah largely without the religiously sensitive healthcare resources they need. The II&M is a leading forum for research, education, and dialogue at the intersection of the Islamic tradition and contemporary biomedicine. Your participation, support, and prayers will enable us to improve Muslim health and serve the Islamic bioethics needs of Muslims around the globe. To learn more about II&M and how you can support us, please visit us online.